I am Dr.A.Praveena, Department of Microbiology, K.S.Rangasamy College of Arts and Science, Autonomous, Tiruchengode. Now I am going to tell you about hemophilia. Hemophilia is a bleeding disorder which is due to the defect in the clotting factor. So normally the bleeding disorder may be due to any changes in the blood vessels or any abnormal concentration of platelets or any clotting factor. So in hemophilia there will be a spontaneous bleeding or any bleeding, uncontrolled bleeding after surgery or injuries. So this hemophilia is normally a genetic disorder which is mainly linked with X gene, X chromosomes. So normally this will be mainly affected only in males than in the women. So women will be acting as a carrier for that disease, and in India you will be having 13% of less number of hemophilic patients than in US. So this is the data obtained now. So hemophilia, sometimes there occurs acquired hemophilia where there may be due to any spontaneous mutation, genetic mutations may occur, and it may result in the bleeding conditions. So such type will be considered as acquired hemophilia, and in such acquired hemophilia we cannot have the family history of hemophilia, or the mother will not be any biological mother will not be a carrier. And an acquired hemophilia may occur when the immune condition, that is a person's immune system, will attack the clotting factors, mainly the clotting factor 8 or 9. So this may be occur during pregnancy, autoimmune conditions or cancer, multiple sclerosis, or during any drug reactions. And hemophilia may be referred to as the royal disease because it was first diagnosed to be affected in the royal families in England, Germany, Russia, Spain in the 19th and 20th century. Actually, Queen Victoria acted as a carrier of this disease, and she transmitted the mutated gene to her sons. And one of the fourth son of Queen Victoria, Prince Leopold, the Duke of Albany, has been born with this disease in 19. Victoria acts as a carrier for the mutated gene, and she transmitted her genes to her sons. And the fourth son of Victoria is Prince Leopold, and he was born in the London in 1953, and he was diagnosed to be a hemophilic patient in 1958, and actually he died of uncontrolled bleeding after his fall in the age of 30. And there are different types of hemophilia. So normally 3 different types of hemophilia are there. It is hemophilia A, hemophilia B and hemophilia C. So coming to hemophilia A, it is caused by the lack of the blood clotting factor 8. So there are many blood clotting factors are there which will help the platelets for the clotting of the blood. So this hemophilia A is the major type of hemophilia, and approximately 85% of all the hemophilic patients will be of type A. And this genetic disorder will be, as I said before, this genetic disorder will be the one which will be occurring only in the males, since it is a X-linked genetic disorder, and this hemophilia A will occur in the ratio of 1 in 5,000 in male births. And next, coming to the hemophilia B. Hemophilia B is due to the lack of clotting factor 9. So this is the second common type, and actually this is also known as Christmas disease. It's also known as Christmas disease because it was named after the person in which this particular type was first diagnosed. So this disorder was diagnosed in the year 1952 in the person named Stephen Christmas, and this is the second type of approximately 15 to 20% of the hemophilic patient will be having hemophilia B. Next, hemophilia C. Actually, it is a very mild form of hemophilia, though this hemophilia C is similar, and it will be entirely different from hemophilia A and hemophilia B. And this is due to the low level of factor 11, and it is also known as Rosenthal syndrome. And coming to the symptoms of hemophilia means, so hemophilia will be, there will be a bleeding inside the organs or inside the tissues like that. So these are some of the symptoms. And coming to hematomas means the internal bleeding will be there in the tissues or muscles. And coming to bruising means, bruising is due to the bleeding of the small vessels under the skin. So you can have a dark patches like things, and that will be considered as bruising. And you will be having a frequent nosebleeds, or you will be having hematuria. Hematuria is the condition where you can see the presence of blood in the urine, or blood in the stools can be observed. And similarly you can have bleeding after the injections, vaccination, surgery, like that and all. And another one important condition is there will be an internal bleeding in the joints, which will be affecting the joints. So there will be different complications also. So due to such bleedings in the body, the spontaneous bleedings, there occurs many complications. So main one can be a deep internal bleeding. So deep internal bleeding in the muscles or the tissues makes the limbs or the arms to swell. So the swelling will constantly may leads to the pain, or it may leads to the numbness due to the compression of the nerves in that particular area. And similarly bleeding in the throat or neck. So internal bleeding in the throat or neck may affect the breathing. So the person's ability to breathe can be affected by this hemophilic conditions. Damage to joints, again the bleeding in the joints may affect the joints, and it may result in the arthritic conditions, a painful one, and complete destruction of the joint may takes place. And coming to infection, for the treatment of the hemophilia, the clotting factors may be transferred from the other humans. So in such cases, there occurs the infection, chances of infection will be more during the treatment. And coming to adverse reaction, and continuous treatment may sometimes leads to adverse reaction where the person's immunity will work against the incoming clotting factors. So these are the main complications which can occur during the hemophilia or during the treatment of hemophilia. And coming to diagnosis, so these type of hemophilias can be diagnosed by various tests. So the basic tests are platelet counts, clotting time, bleeding time, prothrombin activation time, and we can go for the genetic test also to identify properly the which clotting factor or which genetic that chromosomes is involved in the thing. And specific tests for deficiency factors can be done, and even the parental diagnosis can be done, whereby the family history can also be confirmed. And coming to the treatment, actually there is no cure for the hemophilia is occur, but the doctors can maintain maintain the hemophilic condition, and they can prevent the further complicated conditions of hemophilia. And the treatment mainly focuses on the replacement of the less number of clotting factors, or by supplying the clotting factors from the external sources. And clotting factor replacement therapy is the one, and there are some other treatments. By giving the drugs, we can able to maintain or treat the hemophilia. So one such is desmopressin, where in the mild form of hemophilia, this hormone can help to stimulate to secrete more amount of clotting factors. And similarly Hemlibra, and this is a newer drug, and which will prevent the bleeding. So the bleeding tendency may be reduced. And coming to clot preserving medications, and there are some antifibrinolytic drugs which may preserve the clotting. So the clots will not broke down, and that will be considered as clot preserving medications. And there are fibrin sealants which can able to promote the clotting and healing. So if any cut are there, this can able to promote the clotting thing. And coming to, there are some physical therapies also there which can reduce the signs and symptoms of the internal bleeding. So these are some of the treatments that are available or done to the hemophilia. And actually the Hemophilia Day, World Hemophilia Day is celebrated on 17th April, and it gives the awareness and the treatment strategies available in recent days like that and all. And that's all about the hemophilia. Thank you.